Okay. Welcome, everyone, and thank you for joining this important AFSP Town Hall, the third in AFSP's Town Hall series on mental health and suicide prevention in minority communities. Today, we are focusing on preventing suicide in BIPOC communities, highlighting policy and community opportunities to prevent suicide. And I just want to check with my team and make sure that I am in the right mode before I keep on. Okay, they say yes. So the amazing esteemed panelists that we have gathered here today and I are here to create a forum to come together to invite supportive community, especially during this pandemic period, and to spotlight what all of us can do to play a role in preventing suicide, especially in communities of color. We are in the midst of election season, in the middle of a pandemic, and during an incredibly important period of social justice and racial justice uprising. And so there really is no time like the present to come together to raise our voices and really advocate for the changes that we need to see happen. COVID and recent events have laid bare the health, social, and economic disparities leading to disproportionate trauma and suffering and loss of life among people of color. That said, Black, Indigenous, and people of color continue to show enormous resilience and fortitude in the face of these challenges. Now, one recent important event that we're going to be highlighting today is the work of the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health. And we have two leaders of those efforts here with us today. And they will tell us more about it, but you're going to hear about alarming rises in suicide attempts, behavior, and deaths, especially among Black youth. But that is also true among other populations as well, with Latina adolescents showing rises in suicide attempt behavior. And of course, Native American youth having long been a group that we've been very concerned about in terms of their suicide rates. And so today is going to be a time where we try to come together and understand not only what forces at work are going on to produce those untoward outcomes, but what can be done to move forward and how we can all play a role with that in preventing suicide. Now, one other important topic we'll be covering today has to do with health disparities. And I've myself worried that that's a term that is a little bit abstract. And so we're going to try to break that down today just a little bit. And I'll just start out by giving you one example that we've known about for a long time, but it is truly kind of shocking. Studies of implicit bias of healthcare professionals, including physicians, show that medical training does not root those biases out of us as physicians. We still reflect the same biases of the culture, the larger culture that we come out of. So it is, in fact, imperative that all of us start digging deeper and reflecting on those types of unconscious bias. And the way that that plays out, which the Institute of Medicine wrote their landmark report, released that in 2003, and yet we are still seeing these problems of differences in the recognition and treatment of people of color when it comes to cardiovascular disease, cancer, HIV, diabetes, kidney disease, mental health conditions, pregnancy-related conditions, and pediatric health issues. This is absolutely unacceptable, and yet these are the facts. And this is what we mean when we talk about health disparities. So we will spend the first part of our session hearing from our esteemed panel of experts, and then we will open up and have a time of dialogue with you, any of you who are tuning in to our Facebook live stream right now, and we really look forward to that. That is like the fun part for us. So please don't hold back. Submit your comments and questions anytime during this hour, and we will try to get to as many of them as possible. So with that, I would like to introduce our esteemed guests. Our first, let me actually show everyone. So our first guest I'd like to introduce is Congresswoman Bonnie Watson Coleman. Bonnie Watson Coleman is a longtime public servant and advocate for New Jersey families. She was elected in 2018 to her third term in the U.S. House of Representatives. The first African-American woman to represent New Jersey in Congress, Watson Coleman is passionate about the issues affecting working families of all backgrounds, including her work in criminal justice reform, building an economy that works for all families rather than a wealthy few, and rebuilding infrastructure to improve this country and support job creation. She focuses all of these priorities and other critical issues as a member of the House Committees on Appropriations and Homeland Security. The daughter of legendary state legislator John S. Watson, Watson Coleman served 8 consecutive terms in the New Jersey General Assembly and shattered racial and gender barriers as the first Black woman to serve as majority leader and as the chair of the New Jersey Democratic State Committee. Since coming to Congress, Watson Coleman has continued to champion protections for vulnerable Americans. This is through and through her entire public service career. In 2016, she founded the Congressional Caucus on Black Women and Girls, the first caucus aimed at bringing both the tremendous challenges and incredible successes of Black women to the fore in Congress's policy debates. So important. Late in 2018, after learning about the surge in Black youth suicide, Congresswoman Watson Coleman worked with the Congressional Black Caucus to establish the Emergency Task Force on Black Youth Suicide and Mental Health, with the goal of making Congress aware of this problem, identifying both causes and solutions, and supporting federal engagement and ultimately, hopefully, legislation in ending the crisis. Out of the work the task force did, alongside a talented working group of many experts, actually the working group led by Dr. Michael Lindsay, who I will introduce next, the Congresswoman introduced then the Pursuing Equity in Mental Health Act, which would authorize more than $1 billion to address mental health disparities. This is a landmark and extremely important piece of legislation that this team here has worked on and led. So next, I would like to, let Congresswoman Watson Coleman please say hello.
I'd love to say hello if I could just unmute myself efficiently. Thank you for introducing me. I'm so delighted to be here with this very esteemed panel, and I look forward to what I think is going to be a very helpful discussion. Thank you.
Thank you. We're so thrilled to have you with us. So next, I'd like to introduce Dr. Michael Lindsay, a noted scholar in the fields of child and adolescent mental health, as well as a leader in generational poverty and inequality. He is the executive director of the McSilver Institute for Poverty Policy and Research at NYU, the Constance and Martin Silver Professor of Poverty Studies at NYU Silver School of Social Work, and an Aspen Health Institute Innovators Fellow. At the NYU McSilver Institute, Dr. Lindsay leads a team of experts who are committed to understanding the root causes of poverty and developing evidence-based interventions to address its consequences and rapidly translate those findings into policy and practices, which of course is the essential piece that is sometimes missing with research. Among the latest work is a 3-year research grant from the NIMH to study the effectiveness of a novel treatment intervention for keeping Black adolescents engaged in depression treatment. Dr. Lindsay leads the working group of experts, as I had just mentioned, supporting the Congressional Black Caucus Emergency Task Force on Black youth suicide and mental health, which created the report, a very important report called Ring the Alarm, the Crisis of Black Youth Suicide in America. Dr. Lindsay, thank you for joining us at this AFSP Town Hall and for joining us again. Your working group and the task force that you all have convened, the two of you, and especially that Ring the Alarm report has been absolutely tremendous and I think a game changer. So thank you both so much for your incredible leadership. Dr. Lindsay, do you want to say hello?
Hello, thank you, Christine. And it's always a great pleasure to be with the Congresswoman and our other guests. And so I really appreciate this opportunity. And I just want to really quickly say thank you to the members of the working group and my colleagues and collaborators at the McSilver Institute for really making this come to fruition. And thankful, I'm really thankful to the Congresswoman for her leadership. It's been tremendous. And so thank you.
Excellent. And our third guest is Nikki Petrie, who I have the pleasure of introducing now. Nikki's Indian name is Huele, which means meadowlark. She is a member of the Coeur d'Alene tribe and is of the Red Bird clan. She is a direct descendant of several prominent chiefs of tribal nations. Nikki takes pride standing on the shoulders of her ancestors, honoring the foundation they have laid and being a vessel for her grandmothers to uplift the next generation. With a true passion to support Native youth and youth-led programming, Nikki serves as the executive director at the Center for Native American Youth at the Aspen Institute. Prior to being at the Center for Native American Youth, Nikki served at the American Indian Higher Education Consortium. Nikki has worked on behalf of her people her entire life. Her biggest inspiration comes from her daughter, whose name means carry the medicine. And Nikki maintains her culture through language, ceremony, powwows, and honoring her teachings passed on to her. Ms. Petrie, your dedication and passion for tribal people and youth is incredible, and we are so grateful you've joined us for this dialogue about preventing suicide. Please say hello.
Hello, thank you so much for having me. And thank you to the American Foundation for Suicide Prevention, the Honorable Congresswoman Bonnie Watson Coleman, and Dr. Michael Lindsay. Lim Lanchin Chespaus, a heartfelt thank you.
Wonderful. Okay, so let's get started with our conversation. And I would like to start by posing a question for Congresswoman Watson Coleman. Can you tell us how you became involved in this important work related to Black youth suicide prevention and mental health? And of course, your role with this critical task force. And I'm also wondering about where you were when this all started for you, what you learned, and what you've heard from the people as well.
Thank you for that question. I came to this discussion in a very unscientific way. I was looking at my Facebook page on a daily basis to see what's happening, and I noticed this sort of uptick in stories about young minority youth committing suicide or attempting suicide, or discussions about their attempting or succeeding in suicide. And it troubled me so much because it wasn't just like one day or a couple of times I saw it. It just seemed to be coming through on my thread, maybe because I kept hitting the sad button, that I started seeing more and more of it. I said to my staff, we can't fix this, I know, but we need to raise this issue, bring some light to it so that it can be acknowledged for what it seems to be as a problem that is particularly facing very young minority children. I mean, I saw 5 years old, 7 years old, 9, 11, that kind of thing. It just was beyond my comprehension how someone that young would translate that sort of action as a response to whatever it was that they were going through. So as a result of it, I spoke with the chairwoman of the Congressional Black Caucus and shared my concerns. And we decided that maybe the best way to deal with this and to also communicate that there's a sense of urgency here is to set up a temporary task force, an emergency task force to look into this issue. I've been blessed with an incredible staff who just sort of did their research and found Dr. Lindsay and as well as some other very brilliant providers, doctors, academics, activists, etc., we set up this working group that Dr. Lindsay agreed to head. And I'm telling you, his leadership is absolutely magnificent, brilliant, incredible, and brought us to the point where we are today. And I reached out to a number of my members and asked if they were interested in this issue. And moving forward, we came up with the task force. We had a series of meetings. We had interviews that took place with celebrities, non-celebrities, young people, old people, activists, parents, people affected by what we were discussing. And as a result of it, a couple of things happened for me. One is that while we focused on young Black youth, I learned that this issue of suicide as a response to a life situation is broader than just what was happening in the minority community, just broader than what was happening among young Black youth. And it's something that I know we have to continue to work on. But I also found that there is such a stigma to mental health issues, particularly in minority communities and particularly in my community, that we were missing opportunities, I thought, and Dr. Lindsay's work in this area proved that we were missing opportunities to address these conditions proactively. So as a result of all the work on the task force, Dr. Lindsay and his group authored a very important work that you responded to, that you mentioned, sounding the alarm. And we took the information that was revealed through those testimonies and through Dr. Lindsay's work and the work group's work, and we created a piece of legislation. And the purpose of the legislation was to not only shed light on the gaps and the issues and the concerns, but it was to get at resources and needs in those various areas, and to alert other agencies about what we have found, and to work through the Appropriations Committee to put language in there that tells the NIMH about looking specifically at the issue of mental health in our communities among youth, look at the disparities, and put resources in there. And so we're really at a beginning point. The piece of legislation has about $1 billion worth of resources allocated for certain things, including increasing the number of professionals working in the field, increasing cultural competence, as well as looking at best practices and appropriate interventions, et cetera. It's passed the committee, the very important Committee on Energy and Commerce. It is going to go to the floor, and we have a companion bill in the Senate, and hopefully it gets signed, but it's still a beginning. Even when the president signs it, and I certainly pray that he does, it certainly opens up a lot of need that exists on so many different levels, and it's going to take more than $1 billion to address it. And as a result of our work, we've had a couple of conversations with the director of the NIMH, so that he also is aware of the work that the work group did. He's very interested in it, and he's very interested in moving forward in a way that there are more minority researchers, and that issues unique to the minority community are getting supported in terms of research grants. So it's continuing work. It's I think very important work, but I must say that we're really still at the very beginning. Well, maybe at the end of the first stage of the very beginning.
Yes, I mean, that is how change happens, right? And I love that you included something comprehensive that would actually appropriate the funding to support those efforts. It's got, as far as we're concerned, and at AFSP, we supported this bill all the way through, and we will continue to do that. We will continue to work with your team, as well as on the other side of the aisle, to make sure that this has every chance to make it all the way through and then beyond, like you say. I will just add one thing, dovetailing with what you said. At AFSP, we have long been advocating for that appropriate level of research spend on suicide prevention research, and now especially specifically related to diversity and minority communities, where there's been really an incredible dearth. I mean, and at AFSP, we made our own organizational decision to make that our current priority area of our research grants program is diversity, which is a very exciting step to take. We're not that large of an organization, but we are the leading private funder of all suicide research. So we are right there with you every step of the way with that. Dr. Lindsay, before we move on, do you want to just respond to some of the Congresswoman's comments, since you were such an integral part of the work?
Sorry, I was on mute. No, I just want to, again, thank the Congresswoman and the members of the Congressional Black Caucus, the chairperson, Karen Bass, and the other members of the Emergency Task Force for really sounding the alarm, helping us to sound the alarm. We've been doing this work for 15, 20 years or so around what's happening with Black youth. And it was really, really great to have them say, okay, enough is enough, and we need to do our part to ensure that not another youth loses their life before they've even had a chance to live unnecessarily because we did not have the requisite supports and services available to them and their families to be able to get the support they need. And I just want to echo again the importance of the group that we were able to assemble. It was a collective effort, a lot of great intellectual energy and passion, advocacy that really brought it together. And so it took a village, and certainly we called on the village and they responded.
May I say also that we know that we have to continue our relationships with the agencies that will ultimately come up with funding, because we know talk is cheap. You need resources. Our experience has helped me understand that it wasn't not just the Black community, it's the minority communities in general, from American Indian to Latin to maybe even, to even the Asian community. We all have something more unique to deal with in terms of dealing with mental health and what that means and what that says about us. And for so long, we have suffered in silence because it just wasn't part of our culture to deal with it medically or to deal with it in terms of therapy and things of that nature. So this has really been quite eye-opening. And as a member of Appropriations, I hope to continue to raise the discussion and to create even greater opportunities to look at the disparities in health among youth when it comes to mental health.
Yes, and I know you've been a longtime advocate as well for another minority group, that is LGBTQ people, in particular youth. And so we can broaden our view that it's really, today we're talking about any person who has experienced marginalization on the basis of identity. And that trauma, and sometimes intergenerational trauma, is I think it's profound, and it builds towards much of what we're seeing right now. But again, I think what we can focus on today is that there is also human strength and resilience at the core of every human being. And so if the environment is created in such a way that support is there and the stigma is eradicated, then we know that we can make progress, and we've seen that happen before.
Yeah, and I'm grateful to David Johns, who brought to us the issue of the LGBTQ community as part of our exploration here, because you're absolutely right. It affects anybody that is that has a uniqueness that society relates to and marginalizes. It doesn't mean anything about who we really are to ourselves. It's not our truth. It's their misinformation. And so thanks to David, we were able to incorporate exploration into the impact on the LGBTQ community as well.
That's terrific. Okay, switching gears a little bit, Dr. Lindsay, I thought we would just take a bit of a step back for a moment and ask you a question that relates to language and terminology around these issues of populations and diversity, because there has been a lot of discussion about what the most respectful or relatable to individuals who have the lived experience, what that terminology is. So I would welcome any comments you have about that.
Yeah, so thank you, Christine. I've thought about this this question since you posed it to me a few days ago, and I'm going to make some statements and try to sort of bring it home with some key points here. So I've always centered the Black community in my work. There have been lots of statements being made in this period of racial and social reckoning. And so one concern has been that languaging has not occurred in a way that is person forward. Certainly there are commonalities among marginalized and oppressed groups, and we need to fight against the systems that perpetuate that marginalization. At the same time, we need to give space to the issues among different groups that may be more nuanced in nature so that we do not perpetuate marginalization in unintentional ways. In my work, I don't use BIPOC, for example, as a substitute for Black. In the work that we undertook with the Congresswoman, we wanted to be clear about the outcomes for Black youth that needed to be recognized. But certainly there are other groups at high risk, including, as was mentioned, the LGBTQAI youth, the Native American youth, and certainly Latinx youth. In the report, we highlighted findings relative to the experiences of Black youth. For example, our colleagues at Nationwide Children's Hospital, shout out to Ariel Sheftal, who was one of our working group members, has found that 5 to 12-year-old youth in the United States, particularly Black youth, have seen an increasing rate in suicide death. The work that we undertook at the McSilver Institute and the study that I led found that over the period of 1991 through 2017, using the Youth Risk Behavior Survey, we identified that Black youth had increasing rates of suicide attempts. That rate was 73% over that span of time. Black adolescent boys saw 122% increase in having an injury by an attempt. And so relative to the other youth that were surveyed, Black youth were the only group that had rising rates in suicide attempts and an injury by a suicide attempt for Black adolescent males. And so I think in this discourse around languaging, it's important to have certainly inclusive language as it relates to being a part of a marginalized group, but there are also nuances within these groups that we need to highlight and be respectful of so that, again, we don't unintentionally marginalize groups and forget about their specific experiences in this landscape of how we consider and reflect upon how to prevent suicides.
Thank you. That is really helpful. That is where my team at AFSP, that's kind of where we are, is to think about what context are we in, which group are we talking about, and then try to be person forward to fit that specific context. I think it's still that larger umbrella term that is undergoing some debate, and that's fine. It'll have its own evolution. And I think as long as, at least for this session, we understand that when we are talking about this topic, we are being very inclusive, as we said earlier. to any group of people who have that experience of either trauma, discrimination, on the basis of race or identity. And it is meant to be, but there may be parts that are absolutely specific to a certain population. So that's always going to be the case. That's great. So one more question for you, Dr. Lindsay. Back to this concept of health disparities. I'd really love to hear from you about just how do you understand that? Give us some concrete examples. Help the people, kind of wrap their heads around what we mean when we talk about that, and really what you're seeing too.
I appreciate that. Yeah. So as noted by the Office of Disease Prevention and Health Promotion, if a health outcome is seen to a greater or lesser extent between populations, there is a disparity. So race or ethnicity, sex, sexual identity, age, disability, socioeconomic status, geographic location, all certainly contribute to an individual's ability to achieve good health. But certainly there are social determinants that play an important role in terms of health outcomes. It is at the nexus of these social determinants and their impact on one's lived experience that we need to center our work. So for example, in the work that I do on adolescent depression, we know that Black and Latinx youth relative to white youth are likely to not receive treatment for their depression. We also know that while whites might have higher prevalence rates of depression, the chronicity and burden related to the experience of having depression is more caustic, if you will, for Blacks. And so to bridge that gap, I have engaged in interventions at two levels. One, treatment engagement. It's a real serious issue in the sense that addressing stigma and other perceptual barriers to care are important, because otherwise we can build services and interventions, but it does not mean that populations who have been historically marginalized and not affiliated or connected to treatment are going to come to those services. And so as an example of that, and some of the work that we're doing in New York City as funded by the National Institute of Mental Health, we've created an engagement intervention that focuses on perceptual barriers like stigma or perceived relevance of treatment, as well as addressing practical barriers to treatment for Black and Latinx youth and their families to deconstruct those barriers related to treatment. And then at another level, once they're engaged, we have the opportunity to treat undertreated mental health issues like depression. And certainly there are voluminous numbers of evidence-based interventions out there for a number of mental health outcomes. But what we see from a disparities perspective is that marginalized groups are often not connected to those services. And so that is a huge issue.
Yes, indeed. And at that broader level, that statement I had made right at the beginning about all of those different health outcomes. So if that you're a person of color with some cardiovascular disease, kidney disease, diabetes, that whole laundry list I went through, and you you make it into the health system and you see the doctor, you are less likely to walk out of that office with the appropriate diagnosis and an effective treatment plan. I mean, and what you're describing is digging in deep into one specific health condition and adherence to treatment or access to. I think it's fantastic, because it's not going to be one fell swoop, or at least not, that won't take care of the whole picture when it comes to these inequities. So thank you for that. Ms. Petrie, I'd like to turn to you. Thank you for being here. So let me just set the stage a little bit. We know that suicide rates among Native American youth are among the highest, and that these experiences historically of intergenerational trauma, some of the other aspects of geographical rural isolation, having a culture that is shaped by some different forces, some lack of opportunity, high rates of substance use, higher than in the non-tribal populations. And yet it is not a hopeless situation. There are instances of change, growth, decreases in suicide rates, and specific suicide prevention programming where successes have been had. So with that just as a backdrop, we'd love to just hear from you. Tell us a little bit about your journey, your interest in preventing suicide in among Native youth. And I had read about and learned about one program you've championed called Champions for Change. So if you'd like to mention something about that as well.
Sure, thank you. Henchi Tsutin Kwai Chief Spokane Gary, Chief Ignis, Chief Kamaik, and Hill Chief Lashai. Henchaya Squisque Yanement Teque, Hinune Squisque Yuskape, Yistinte Squisque Huele, Henchi Stemiche Squisque Appleton Raymond Zuten, Chinstits Imsh. And my culture, if you want to know who I am, you need to know who my family is. And so my story starts before I was born. I'm a direct descendant of 4 chiefs who I had named. My grandmother's name is Winding River, and my mother's name is Snowbird. I am Huele, which means meadowlark, and in our ways, meadowlarks bring good medicine, and I hope to bring that to you today. My daughter's name is Carries the Medicine, and my English name is Nikki Petrie. I'm a member of the Coeur d'Alene tribe. I've worked at the Center for Native American Youth for over 2.5 years, professionally for Indigenous-led organizations for 11 years, but I worked on behalf of my people, Indigenous people, my entire life. The Center for Native American Youth was founded by retired Senator Byron Dorgan of North Dakota to address Native American youth suicide. We're all too familiar that this epidemic impacts Indian country at a disproportionate rate. But I want to be clear, these statistics do not define us, and we will honor those who we have lost and support families and communities who have been impacted by those who have taken their lives. At CNAY, we run programs that focus on empowerment, support, love, and giving youth agency, whether it's through providing leadership building skills through programs such as Champions for Change or taking part in our Native Youth Our Medicine campaign. All of our programming comes from an empowerment and youth-led model. We pride ourselves in allowing Native American youth to be the drivers of the vehicle in the change they desire to see, including intervention and prevention mechanisms. We see impacts of intergenerational trauma that stems back all the way till colonial settlement. We see the effects of that today, from geographic displacement, violence on Native women, girls, Two-Spirit, violence on Mother Earth, or education and political systems that clearly were not designed for the benefit of Native American people. These are all contributing factors designed to inhibit Indigenous excellence. However, more importantly, we see historical and intergenerational resilience. Myself, I know the power that I carry as an Indigenous woman and mother. I am a product of that intergenerational resiliency. It is important to note that tribal communities isn't just reflective of reservations, as over half of our population is from urban spaces. We also have rural and village communities that represent Indian country. And working towards strengthening resilience, we rely on cultural teachings, intergenerational learning spaces, normalizing discussions on healing and self-love, youth-led programs with the knowledge that the work that we are doing isn't just for us, but it's for our sacred little ones in the next generations.
Wow, that's such powerful words. I love that not only you focus on the strength and the resiliency, but that you are empowering that next generation to own this and to live it and to role model it, because they are, of course, the hope for the future in terms of what will be required to make changes. So that is just fabulous. And thank you so much for the work that you're doing. I'm sure there's just so much that you learn from them as you're developing these programs and mentoring them.
Yeah, all of our programming is prevention. We run an art competition engaging young people from 5 all the way up to 24. We have national recognition programs. We're running a civic engagement campaign called Democracy is Indigenous. All of our mechanisms, like I said, come from an empowerment model and engaging young people from all different capacities, all different education backgrounds, walks of life, tribal affiliations. But when they come to the Center for Native American Youth, they know that they're going to receive the technical assistance, resources that they need, and that they're going to be empowered to make the change that they desire to see.
I love it. And I am just interested to learn from you, how do mental health services fit in terms of that, messaging and that space?
Absolutely. So we have initiated a campaign with some like-minded organizations called the Native Youth Are Medicine campaign. And we want to create a space where young people are normalizing conversations of self-love, self-care, and healing. As Dr. Lindsay had mentioned, and the Congresswoman had mentioned, there's a huge stigma in our community as well, in Indigenous communities, that mental health is not something that we talk about. So what can we do to normalize conversations and empower and ignite conversations? How beautiful would it be to see young people say to themselves, I love you? And how beautiful would it be to overhear conversations of young people talking about self-care and healing? How beautiful would it be to look out into our tribal communities and seeing young people touching Mother Earth, because we know that Mother Earth is healing? And, I really find such power and strength when we're able to just really allow young people to lead in this space in normalizing conversations that destigmatize mental health.
Yes, yes. And, it's this sort of, at times the balance between always emphasizing that even when someone is suffering and in distress, there is resilience and strength to be had, and treatment can fit in as one piece of that, of all the slices of the pie. And I think, in many instances, we have not been tapping into that, the strength of the community itself. And, I think we have a lot to learn about that, actually, probably for across populations. Congresswoman, I want to come back to you and thinking about this more multimodal view of where, I live and breathe suicide prevention. And yet it's not just about your psychiatric condition, mental health. It is about so many aspects of what's going on in a person's life and environment that also play a role in terms of suicide risk. And so I had noted that your work has covered so many areas, from restricting the use of solitary confinement in adults who are incarcerated, the Medicaid expansion during crisis bill, pay for essential workers, COVID-related health disparities, and so many more. And again, from my very specific suicide lens, I made note that everything, or most of what you're doing, actually has an avenue into preventing suicide. It's a way that all of those pieces of those risk factors can be shored up, and individual strengths can rise up. So, I commend you for that. First of all, you have an incredible ethic and heart about you. I am curious, in this long journey of work that you've been doing, and specifically now related to what you know about mental health and suicide, what are the indicators that give you hope these days?
Well, I think having discussions like this, sharing information and enlightening people and enlightening lawmakers on the issues and the opportunities and the needs. I think that those things are vitally important, but I think we also can't just segregate this out, because you mentioned that there are things other than someone just feeling, why is that person feeling badly? It doesn't necessarily mean that there's something physically wrong with that person. Living in poverty, living with family insecurity, living with food insecurity, being bullied, living in unsafe communities, just trying to walk from your home to your school without being harmed. I think all of those things impact who you are, what you are, and how you translate life. And so I think that when we look at something of this nature, we need to look at the impact of poverty and how we address those issues of loss and inadequacy, from education to healthcare to food to housing security, all of those things. And so some of the work that I've been really trying to push out lately, and thank you for recognizing that there is a kind of theme to the work. Some of the things that I'm trying to push out may be looked upon as a little bit out there, but like I believe in a universal income. I believe that a family is entitled to a certain level of income beneath which they shall never go. And that if that's a responsibility, if that's the need from the federal government, and so be it, that's what we're supposed to do. I believe in things like baby bonds. An infant gets a bond a year until they're 18, so that when they turn 18, they get to, make a choice, and then they're not starting at the negative side. They're at least starting at the beginning where they should be. I think that we have to eliminate poverty, and I think we have to deal with racism and other forms of discrimination. I think that this is a troubling time, and as well as a time of opportunities. And as an optimist, I look at the opportunities here. We've got more discussion about racism and treating people who happen to be different badly, poorly, or dismissing them. This conversation has been more honest than ever in my lifetime. People of all nationalities and all identities have come together across communities in this country, speaking out and demonstrating against injustice and raising issues about fairness. Even people around the world have joined us to some degree. So this moral moment is a movement, and we need to put as much on the table that addresses the underserving of our communities and see how far we can go. Because we're not going to have this leverage forever. Things ebb and flow. So to me, it's a time you look at Sheila Jackson Lee's bill on reparations, or Barbara Lee's bill on reconciliation and things of that nature, or some of the housing bills that we have, or the building minority wealth, all those things. We never had these really difficult conversations when the government wants to give millionaires and billionaires big tax credits and make them millionaires and billionaires. But when it comes time to talking about giving to those who are the least among us, we got to jump through hoops, and we get only a fraction of what we ever need, knowing darn well that if you want the economy to be better for everyone, you need to put money in my hands, because I'm going to spend it on the things that I need and I want, and so are the people like me. So I think that this is an opportunity for all of us to come together and say, well, how do we get at the root cause, one of the root causes of the way children have such fatalistic responses to their lives? What are those conditions that we really can change? And I think we can change the condition of their living experience, their access to education, their access to healthcare, et cetera, helping their mothers and their fathers navigate being mothers and fathers, and helping to heal our communities that way. I know that sounds kind of, Pollyannish, but that's what government should do. I mean, we need to take a page out of Franklin Delano Roosevelt when we had to just rebuild. Well, we're at that stage. We need to rebuild. We need a big infrastructure program. We need fairness. We need healthcare, and we can do it. And that's why I'm where I am. And that's where I expect to have conversations with my colleagues.
I couldn't agree with you more. I'm of Chinese descent. I'm half Chinese. And the Chinese character for crisis is half crisis and half opportunity. And what you're saying is so true. Right now, there's a moment of energy that where change can happen. So I couldn't agree with you more. Let me turn now to our participants on this live stream who are sending in some questions. And so for Ms. Petrie and Dr. Lindsay, let me ask you one that's come up from our participants. It is, what can we do to implement educational programs on the warning signs of suicide and how to ask for help, how to connect and reach out. What would that look like in your mind's eye?
Nikki, I'm sure I can jump in there. One of the things that we actually wrote about in the report is the need for sort of universal in the schools, universal programming around the signs and symptoms. One program that comes to mind is mental health first aid. Certainly, we also need mental health professionals in schools proportionate to the number of kids in schools, not just one mental health professional for a particular school, but proportionate to the number of kids in the schools. What we find is that when services are co-located in schools where kids are, one study found that they're 21 times more likely to use school-based services over community-based services. So that becomes really important. And while that professional is in the school, they also have the opportunity to work with teachers and administrators on what those signs and symptoms look like so that we don't engage in implicit biases. Because what we know is that Black and brown kids are more likely to be expelled from school. And so they're expelled oftentimes for issues that are behavioral health issues in nature. And so in addition to that, I think one more thing is really important is that we need to ensure or advocate for social emotional learning standards. What we find is that not even more than 10 states in our union require social emotional learning standards from K through 12th grade. Oftentimes just from K through 6th grade. We need it from K through 12th grade because if kids have access to those kinds of resources, they will understand how to reconcile their frustrations and challenges at emotional levels that they have. They will learn how to engage in relationships that are healthy and promotive of their emotional and well-being, and how to understand when they're not, and what to do about that. And so I think there are a number of things that we can do, and I'll stop there.
I would like to also add in, especially when it comes to Indigenous people, the importance and visibility. We need to restructure our history classes, our mathematics classes. We need to start incorporating culture and visibility. How often, and myself included, are young people, Indigenous people realizing, am I subhuman? Am I only a historical context? And so those are barriers that inhibit Indigenous excellence that I was talking about earlier. So just truly want to emphasize the importance and cultural competence in any kind of curriculum, no matter at what grade level. Normalize intergenerational learning spaces, and really highlight and support any kind of culture that we're able to incorporate into education, recognizing that education is more than just Western classrooms. I think about my grandpa, and he wasn't allowed to receive education past, the 4th grade because of boarding schools. Yet he is so knowledgeable about Indigenous plants, healing, that he's a scientist. And so recognizing the importance in Indigenous ways of knowing and learning. And so when I think about the classroom and the ways to make sure that we're connecting and reaching out, we need to bring the community in.
Fantastic. I'm saying amen and preach it to all of the above. Without these kinds of changes, and the way it works is the people need to speak up and get involved, and then policymakers like yourself can, in fact, have some success with the language and the bills that you create. So that is when we see things really working as they should. So thank you for all of those fantastic ideas. Believe it or not, our time is drawing to an end soon. And I want to say that people are asking questions about what more can they do. And so I thought that we might end our time by, in a way, creating an invitation to people and Congresswoman, you know how important this is, to use their voice and to speak out. So I would love it if we could if you have a suggestion for maybe one thing that they could use their voice for. So let's start with you, Dr. Lindsay, if you don't mind on this one.
Yeah, sure. I think that in your local school, whatever school that's closest to you, I would say that you should seek out to try to understand whether that school has behavioral health providers. Kids are struggling with the impact of COVID, the racial unrest, and they're coming back to schools with host of issues, grief, loss, etc. And if there is not behavioral health professionals or services available at that school, call your local elected official, bombard them with phone calls and advocacy to ensure that those schools have the requisite behavioral health services that they need.
Wonderful. Thank you. Ms. Petrie, please.
I cannot stress enough the importance in just being a good relative. Let's come together. Let's put our arms around our sacred little ones in the next generation. Let's uplift and promote youth-led efforts and normalize conversations about healing, self-love, and self-care.
Beautiful. Thank you. Congresswoman Watson-Coleman.
Thank you. I think that we need to use whatever institutions that we're engaged in to see if we can promote more people being trained in the mental health first aid kit, because that helps you to see signs in a different way, and even to volunteer through the PTAs for schools so that we could have more teachers aware and alert. And I think the other thing that gets policy makers to respond is your vote. It's so vitally important that you decide who you're going to vote for, predicated upon what your needs are, your issues are, and what that person has either done or says he or she is going to do if elected. That's so vitally important.
Absolutely. We need to use our power as citizens in that way, and in all of these ways in your local community as well. So thank you for the incredible wisdom. I'm going to use moderator privilege and add my own invitation to anyone who's tuning in to just remember that AFSP is an organization that isn't just, up here in the pie in the sky national level. There is an AFSP chapter in every market across our 50 states. And so that means a number of things. It means if you want to get involved or get answers from the science, tap into support and referrals. If you have lived experience or a loss experience of your own, there is so much power in connecting with community. And we are very blessed with that in our AFSP network across the entire country. The other thing that we are incredibly fortunate to have is a strong policy team at AFSP, which makes it easy for anyone to sign up on our afsp.org webpage to become a voluntary field advocate and join the more than 30,000 individuals across the country who are responding to our recommendations when bills like the ones you've heard about today come up at key times, because the average person can't keep track of what's happening at the state level or at the national level. And so we make that easy for you by vetting these pieces of legislation and letting you know when the time is right to make your voice heard. So please go to afsp.org to learn more about how to get involved in those ways. So I will now close our time by speaking to the people who've joined us. First of all, we really hope that everyone who has joined has felt the sense of sort of solidarity and community, even across different types of experiences and populations, no matter what your background is, and that you have learned something or gained a bit more of that sense of urgency around these issues, and that we all have a role to play. We do know that these are not quick fixes. This is something that we stay with, but any added voice to the choir can make a difference. So we want you to be involved and to help us keep pressing for those changes. And also remember that especially during this pandemic time, it is okay not to be okay. That we all go through times where we're not our best, and that is okay. And that no matter where you are in your journey, you are not alone. and others are there with you in solidarity, and reaching out can make a huge difference as well to connect with others. Thank you so much to our incredible panelists for shining a light on mental health disparities, the issues that your people are facing, and what we can do in response to those issues. We are all in this together, and are at AFSP very committed to ending inequities, race-driven disparities, any marginalized community, again, including LGBTQ related issues that in fact drive suicide risk. And we know that prevention can work. So I will end there and just remind people that the next town hall in this series is on October 15th, and it will be an AFSP town hall focused on research, but in BIPOC communities. Either the researchers themselves are from those communities, and or the focus of their research work is on that. And as I mentioned, that is the newest and very important priority area of our research grants program. And the last one in our town hall series for 2020 will be on November 6th, and it will focus on suicide loss survivors among diverse communities, and how culture and stigma play a role there, but how we can all learn how to support one another, especially after a time of suicide loss. So we will end our time there, and thank you again to our esteemed panelists.